Hey everybody, it's Dr. Kimmel again. I'm just going to give you a little update because we're going to open up on Monday now. We've kind of waited an extra week to open just to see how things were going to fall out and make sure that we had plenty of the protective equipment we needed, and we needed to do a couple little changes in the office. And I'll show you what those are. Actually, one of them starts at the front door. We are going to go ahead and just not have anybody come into the waiting room anymore. What we're going to do is when your appointment time comes, we're going to have you wait out in your car. And we're going to call you on the cell phone and let you know to come on in. That way there's only one person in the waiting room at a time. When you come in, you're going to come right on up to our entry station, which is right over here. And this is where things get totally different. And they're actually going to take your temperature to see if you're hot or not. All right? And I'm definitely hot. And then what they're going to do is they're going to ask you a couple questions, and you just fill out this little form. And these are all things just to make sure that everybody's healthy as they're coming into the office. And that way, when you come in, you don't have to worry about any issues. They're also going to give everybody a mask. So you'll go ahead and put a mask on when you first come in. And then they'll go ahead and you can, thank you very much, Susan. And you can wash your hands as well. And that way, we cut down on any cross-contamination. Thing is after you leave, they're still going to wipe down this counter. They're actually going to wipe down the handles on the doorknob so the next person coming in doesn't. Yeah, we use the old Cavicide wipe. All right, that's my little Vanna White over there. And if you notice, Vanna, or Suze, she's got a mask on. All the front desks are all going to have masks on. So you're not going to be able to see their cheery faces, just their cheery eyes, and they'll take care of you. Now, one of the things that will happen when they schedule you and you pay for your services, you're only going to be the one person up here at a time, which is going to make things a little different because we're used to visiting and spending a lot of time with each other. Unfortunately, until this thing dies down a little bit, we can only have one person in the waiting room at a time. So we have this really neat little dance that we're going to be doing to orchestrate it to make sure we run on time, because we always like to run on time, and we like, so you can plan, okay? Because we never like to have you wait. All right, so we orchestrate that. So you only get to speak with Susan a little bit, but after you're done, they're gonna wipe this area down again like we always did, and they'll wipe the pins down as they always did. Now come on back. There's some things that we're doing a little different back here as well. Oh, and you can actually see Virginia's come in, and she's redoing this whole room. So we have these little things, teaching aids that she uses, and unfortunately what we have to do now is we have to take them out of the room, so we have a basically bare minimum room. And come on back. I'll show you what's going back on the operatories. We've done a couple things different in the operatories. Whoa! You can see Kaylee back here. Kaylee's in our new outfit. She's going to be fully gowned. Looks like she probably gained a little weight over the quarantine and hiding it with her gown. She's going to have a face shield, and then of course we have her N95 mask and this wonderful head bonnet. I think it makes her look really good. All right, so along with that, what we have here is a HEPA filter, because one of the concerns that people have is air contamination between patients. So this little guy cycles the air and filters out the viruses and bacteria. But keep in mind too that, remember, we always have you do a rinse, and now we've changed the rinse to be a little bit more selective to the COVID-19 virus. So we do that. So there's a rinse to cut down on the virus that might be shedding if you happen to be an asymptomatic carrier. And the other thing is, the water that we use is not regular water. It actually has a product in it called hypochlorous acid. It's a food edible type disinfectant that's actually found in grocery stores. When you go to the grocery store and they're spraying the water on your vegetables, that's actually hypochlorous acid. It kills the bacteria and viruses. We use that in a low concentration. You can drink it. We use it as an eye wash. Actually, that's what we also use for facial disinfectants. So it's not just plain water. So we're keeping the viral and bacterial counts down. And one of the other things that we do is when we're done, because there's been some issues about how long does it stay in the air. I mean, the news was saying at one point that it stays in the air for 4 hours. Well, they took that from a study that was done in a laboratory that had airflow that kept it in the air, because they wanted to see how long it was viable in a particle of water or mucus. Okay, so it falls out of the air within 30 minutes, but we don't want to wait that full 30 minutes. So what we do is this: we want to make sure it's out of the air. So we use a defogging agent. So we defog the room, kind of like that. Kill anything that we shouldn't have in there. And then what we do is we close the room up and we let it sit for a full 30 minutes. Because it's 30 minutes without doing this, the virus falls to the ground. So we're killing it, and we're also getting to the point where it's heavy enough that it even falls. Once it's down, then we go in and clean. So it's almost an hour between uses of rooms. And that's typically what we did, was an hour between rooms. All right, so we're trying to keep you safe and keep us safe and everybody safe. So if you have any questions or concerns, give us a call.